OET speaking roleplay. Sample test 1. Heart attack. Medicine. The following roleplay transcript does not contain any language errors. Practice and succeed. Doctor roll card. Pause the video and read. Patient roll card. Pause the video and read. The roleplay will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the roleplay, please? Good morning, I'm Dr. Sue. May I just confirm your name and date of birth, please? Certainly. My name is Patricia Smith and my date of birth is the 17th of March, 1971. Thank you, Patricia. Nice to meet you. I understand that you were discharged from hospital 4 days ago. Is that correct? That's right, yes. I'm so glad to be home. How are you feeling? I'm happy to be home and I'm feeling much better than I was 2 weeks ago, but I am really quite tired and I'm a bit worried about that. I understand your concern, but let me assure you, it's completely normal to feel tired after a heart attack. You can expect to feel like this for 4 to 6 weeks. I understand you had a mild interior acute myocardial infarction, and then you were treated in hospital. Can you tell me a little more about the treatment? Yes, I had a heart attack, and yes, I was in hospital. Did you have any procedures? I'm trying to understand whether you had any surgeries in hospital. No, I didn't have an operation. They gave me some medication, and that made me feel better, and they hooked me up to some machines. So the tiredness returned 4 days ago when you got home from hospital, is that right? Yes, I suppose after the heart attack, I expected to feel a little bit tired, but the tiredness hasn't gone away, so I'm just feeling quite anxious that maybe this is going to be normal for me now, and that I'm always going to be tired. I understand. I know it's challenging for you, but recovery and the healing process take time and patience. Please, let me ask you a few questions to try and understand the situation better. Are you getting enough sleep? I think so. Maybe not quite as much sleep as I did before the heart attack, but yeah, pretty good. How many hours on an average workday, Patricia? Well, I like to have 8 hours sleep every night, but I think I'm waking up maybe once in the night at the moment, so it's not a complete 8 hours. I see, 8 hours. How long does it take you to go back to sleep if you are woken up during the night? It can take a while. It depends if I've got something on my mind. I put the radio on and listen to some classical music. That helps. And before the heart attack, did you ever feel like this? No, and the heart attack was completely unexpected. I understand. Well, in hospital, they would have done all the necessary investigations to exclude any underlying or unrecognized illness that would contribute to your tiredness. So let me reassure you that this is purely due to the normal bodily reactions after the body undergoes an event like a heart attack. It is normal that you will be feeling tired in the next few weeks, but eventually we are expecting that your full energy levels will return. Okay, so I'm not going to feel like this forever. Absolutely not. That is why I would like to address something else with you that will help you with your energy levels. It's called the Cardiac Rehabilitation Program. Have you heard about it? I think they mentioned something about it in the hospital, but because they talked about walking and swimming and exercising, I didn't think it was such a good idea because I don't want to have another heart attack. Well, cardiac rehab is all about gradually increasing your exercise levels so that you will be able to tolerate more exercise without getting any chest pain or what we call ischemic pain. By gradually increasing your exercise, the circulation in the body will improve, and that will not only make you less vulnerable to ischemic events, but it will also improve your overall feeling about yourself. Just by being able to exercise, you will not feel as tired as you are feeling now. Okay, I do worry though. The doctor said if I had another heart attack, it would be more severe, and because I'm feeling so tired, I worry that doing exercise is going to make me more likely to have another one. I understand your concern, Patricia, but try not to worry. The cardiac rehab is guided and coordinated by professional physiotherapists who are trained in this field, and that's what they do. They are experts at rehabilitating people who have undergone the same problems as you have and are recovering from a heart attack. Are you following me? Yes, I am. Great. On top of the exercise, we do have to address a few other things, and they are the other contributing risk factors to having another heart attack. It is important that you try to lower your cholesterol by eating healthily. Try to eat plenty of fresh fruit, whole grains and vegetables, and avoid processed food, alcohol, and excessive caffeine. Try to stay moderately active too. Exercise is good for you. If you change your lifestyle, your chances of having another heart attack are quite low, especially if you find ways to maintain normal levels of cholesterol, lose weight, and strengthen your heart by engaging in a graduated exercise program coordinated by cardio rehab therapists. Are we on the same page? Yes, I understand what you are saying. Can I ask about your job? What type of work do you do? I'm an office worker. I work in the IT sector. I sit at a desk all day and don't get much exercise at work. I see, you work in an office. It will be at least 4 to 6 weeks before you can return to your desk job, and you need to be physically and emotionally ready. You cannot rush back to work. You should plan your return carefully and get assistance and support from your employer. Do you have any concerns about that? No, I don't. Thankfully, my employer is very supportive and is keen that I do whatever I need to do to make a full recovery. That is great. I'm very happy to hear that, and I hope you feel rejuvenated soon. Remember, we are here if you need to talk. I will see you soon. Thanks, doctor. Goodbye for now, Patricia. Take care and look after yourself. Your turn to practice. Pause the video, practice, and succeed.